name is Gabby and I'll be your nurse practitioner for today. I'll be doing a focused assessment of your gastrointestinal, musculoskeletal, and neurological systems. Is that all right?
Yes, that's okay.
Okay. We can start off with your name. Can you please tell me your first and your last name?
Mary Smith,
And your date of birth?
1/26/1980.
Okay. And can you tell me where we are today?
In the doctor's office.
And what year are we in?
2025.
Great. So our patient, she's awake, alert, oriented times 3. I just want to take a general observation of her appearance. Caitlin is well groomed. She's appropriately dressed for the weather. She's answering questions appropriately, and her skin tone is consistent with her ethnic background. Now we are doing the gastrointestinal assessment. Is it okay if I lift up your shirt?
Sure.
Okay. And of course, before doing this, I wash my hands. Now that I have a view of his abdomen, I just want to do a visual inspection before anything, just to see if her abdomen is nice and symmetrical, if I can visualize any pulsations or any visual masses on her abdomen, which I can't. And her abdomen looks nice and normal. It's not overly protuberant or round. Before I start off with the rest of my assessment, have you had any nausea, vomiting, or diarrhea recently?
Nope, I haven't.
When was your last bowel movement?
3 hours ago.
Okay. And do you go to the bathroom regularly every day?
Yes.
Okay, and that's regular for you?
Yes.
All right. So after inspection, we'll move on to auscultation. I'm just going to take a listen to each quadrant of Caitlin's abdomen. I'll be dividing her quadrant into 4 sections, starting off with the right lower quadrant, moving to the right upper quadrant, to the left upper quadrant, and down to the left lower quadrant, working my way clockwise, okay? And when I auscultate each quadrant, I will be listening for 2 minutes. I just want to take a listen to the character and the frequency of her bowel sounds. So I'll be auscultating for 2 minutes for each quadrant, okay?
Okay.
Okay, great. So Caitlin's bowel sound, norma active. She doesn't have too little bowel sounds or too much bowel sounds, so they're not hypoactive or not hyperactive. Now I'll move on to percussion of Caitlin's abdomen. I'll be starting off in the right lower quadrant and work my way to the left lower quadrant in a clockwise fashion. And I just want to make sure that each quadrant has a tympanic sound that I hear, okay? Great, and I hear timpani in all the quadrants. Now I'll be percussing for Caitlin's liver, just making sure that it's in the correct anatomical position in her body and making sure that it's not enlarged. And I can percuss here. It sounds a little more dull, indicating that this is where her liver border is, which is about 5 centimeters, which is normal. Now I'll percuss for her spleen. And now we'll move on to palpation of her abdomen. I'll start off with light palpation. While I palpate, I also want to take note of any facial changes or any facial expressions, any grimacing or guarding, which may indicate tenderness or pain. But Caitlin can also let me know if she feels any pain while I palpate, okay?
Okay.
Thank you. Yep. And I'm just palpating for any masses in the quadrant. And I don't feel for any masses. Now I'll move on to deep palpation. This is 4 to 5 centimeters as opposed to light palpation, which is about 1 centimeter. So I'll palpate deeply just to assess for any masses or organomegaly or enlarging of your organs, okay?
Okay.
Just let me know if you feel any tenderness. And while I do this, I'm using a bimanual technique to assess and palpate. Tenderness? Nope. Tenderness? Nope. Tenderness? Nope. And I don't feel any masses. Here in the right upper quadrant, I can palpate Caitlin's liver border, which again is about 5 centimeters, which is normal. And then I'll move on to the left upper quadrant to feel for her spleen. And normally the spleen should not be palpable, which it's not. Now we can move on to palpating your kidneys. So I'll move to the side, just lift up. You can lay flat. Palpable on this side, you can lay flat, and it doesn't feel palpable or enlarged on this side as well.
Okay, so now we're going to be moving on to the musculoskeletal assessment. Miss Mary Smith, I'm just going to ask you to clench your jaw for me. And then I'm going to ask you to move your jaw to the left and to the right and forward. Any pain? I'm going to ask you to move your head against my hand from the other side and turn your head to the left and to the right and up and down. Any pain? Nope. Okay. We're going to move on to your shoulders. Any pain when I palpate? Nope. And can you press up against my hands? Good. Any pain? Nope. Now I'm going to ask you to stand up. I'm going to ask you to lift your hands up in the air and forward and back and behind your head. Now I'm going to ask you to move them to the side. Any pain at all? Nope. Okay. I'm going to ask you to move your arms, like bend your arms, okay? And out. And then the same with your wrist. You're going to go like this. And just move your wrist up and down, up and down. And now the same with just your fingers. Oh. Any pain at all? No. Okay, you can have a seat. I'm just going to palpate your elbows. Any pain? No. Any pain in your wrists? No. Any pain in your hands? No. In your fingers? No. I'm going to ask you to move against my hands, out and in. Good. And here. Hard press up and down. Good. Nice and strong. I'm just going to palpate the joints in your fingers. Any pain at all when I palpate? No. And her joints are nice and normal. There's no abnormal swelling or arthritis. No cracking when I press down on the joints of her fingers. Can you go like this? Any pain at all? No. Bend your elbow. Push against my hand. The other way. Any pain? No. Good. And the same. Any pain? No. Good. Okay, Miss Mary, now I'm going to have you lay down. And we're just going to assess the joints of your hips. Any pain at all? Nope. Okay. Are you able to bend your right leg? Yes. Up and down. Again, up, and then you're going to go out. Any pain at all? Nope. And we're going to go in. Any pain? Nope. Good. We're going to do the same with the left. Up and down. Any pain? Nope. Okay, up and out. Nope. Any pain? And up and in. Any pain at all? No. Good. Okay, now we're just going to put your legs out just like this. Keep your legs nice and straight. We're going to lift it out. Okay. And in. Any pain or discomfort? Nope. And here? Nope. Any pain? Great. Okay. We're going to do the same thing, but now I'm going to hold. And you're going to push against my hands. Good. And the same on this side. We're going to push out. And then push back in. Good. Nice and strong. Okay, now pull your leg as far out as you can against my hands. Good. And in. And the same with this side. We're going to go out and in. Good, nice and strong. Okay, now I'm just going to palpate your ankles. Just going to expose your ankles. There's no swelling or redness or discoloration. Any pain when I palpate? No. Have it on this side? No. Okay. For the sake of this video, we will keep your socks on. I'm just going to palpate the toes, or the joints in the toes. Any pain at all? No. And on this side? No. Perfect. And now we're just going to check the length of your legs. They're nice and even. One is not longer than the other. Are you able to bend your ankles up and down? And now against my hands. Good, nice and strong. Okay, now I'm going to have you sit on the side of the bed. Dangle your feet. Good. I'm just gonna palpate your joints here in the knees. Any pain at all when I palpate? Have you been having any pain while doing any activities, walking, running? Nope. Okay. Very good. No swelling. So now I'm gonna ask you to straighten your legs out. Good. And you can drop your legs. And again, I'm just gonna test your strength. Just push against my hand. Okay. Push against my hands. Good. And now I'm gonna ask you to stand up. Raises. Now put your hand against the stretcher like this. And you're gonna bend your right leg as far as you can backwards. As far as you can. Good. Any pain? No. And the left side will do the same thing. Any pain? No. Good. And now while you're standing, we're just gonna examine your spine. You can check and palpate your spine. Any pain at all? No. Good. And I'm just looking to see the curvature of your spine. You can turn to the side. Good. There's no kyphosis or lordosis. Just nice and normal, nice and straight. Now I'm gonna have you bend over while you're on the side. Okay. I'm just gonna bend over. Try to touch the floor. Okay. And are you having any trouble? Nope. And the spine is nice and aligned. Okay. Okay. Now I'm gonna have you, I'm just gonna check the range of motion of your spine. So you can take a step forward. I'm gonna have you put your hands on your hips and you're just gonna stretch to the right and stretch to the left.
Now I'll be moving on to the neurological assessment. So first we want to test her cranial nerves 1 through 12. For cranial nerve 1, Caitlin will be identifying the odor that I show her. So just close your eyes for me. And close one nostril with your finger. And take a sip. And what do you smell?
Eucalyptus.
Great. And the same with the other side. And take a sip. What do you smell?
Eucalyptus.
Excellent. So cranial nerve 1 is intact. Now we'll test for cranial nerve 2, which is the visual field test. So Caitlin, can you please take off your glasses? And just let me know when you can see my finger in your peripheral vision, okay?
Okay.
And follow the movement of my finger just with your eyes.
Okay.
Okay, great. Cranial nerve 2 is intact. Now we move on to cranial nerve 3, 4, and 6 with my pen light. Please take off your glasses. Okay, I'm just going to shine this light in Caitlin's eye. And again on the other side. And her pupils are equal, round, reactive to light, and accommodate. So Perla is present. And I don't see any extraocular movements when I shine my light in her eyes. So cranial nerves 3, 4, and 6 are intact. And can you blink nice and hard for me? Okay. Cranial nerves 3, 4, and 6 are intact. So now we'll test for cranial nerve 5, which is facial sensation and the muscles in her masseter and temporal. So again, I'm just going to palpate. Any pain or tenderness? Nope. Pain or tenderness? Nope. I'm going to have you clench your jaw. Good. Any pain or tenderness? Nope. Good. Now we'll move on to cranial nerve 7 with your facial movement. I'm just going to ask you to lift your eyebrows up. Nice. Give me a nice big smile. Frown. Good. Cranial nerve 7 is intact. Cranial nerve 8 is testing for her hearing acuity. Can you hear me?
Yes.
How about now? Yeah. Great. Cranial nerve 8 is intact. So cranial nerves 9 and 10 will assess for palatal movement and swallowing. So I am just going to ask you to say ah, and swallow. Any difficulty at all?
Nope.
All right, cranial nerves 9 and 10 are intact. Now we'll move on to cranial nerve 11, testing the strength and movement in her trapezius and sternocleidomastoid. Just push against my hands. shrug your shoulders. Any pain? Nope. Great. Cranial nerve 11 is intact. And now to the last cranial nerve 12. This is just going to be testing the movement and strength of her tongue. So I'm going to ask you to open your mouth nice and wide, stick out your tongue, move it up and down, left and right. Any difficulty with that? No. Great. Her cranial nerve number 12 is intact, and cranial nerves number 1 through 12 are intact in our patient.
And now I'll just be checking your sensory function while you're seated. I'm just going to have you place your hands on your thighs and rapidly move them back and forth like that. Excellent. Your RAM is present and symmetrical. Now I'm just going to ask you to do the heel to shin test. So I'm just going to ask you to take your right heel and move it down your left shin, and the same with your left. Excellent. Now I'm just going to ask you to close your eyes, and you're just going to tell me if the sensation you feel is dull or sharp. Okay? Dull. Sharp. Sharp. Dull. Excellent. Your sensory function is normal, and now you're just going to tell me if the sensation you feel is hot or cold. Okay. Hot. Cold. Great. And now I'll just be testing for your proprioception. I'll be moving your fingers up or down, and you're going to tell me which direction I move them in, okay? Okay, just going to close your eyes. Up, down, up, down. Excellent. And proprioception is normal. And now I'm just going to ask you to identify what number I write in your hand. Excellent. And that's just assessing for your cortical sensation, which is normal. Now I'm going to test your cerebral function while you stand up. So I'm going to have you stand. Okay. So now I'm going to be testing for your cerebral function while you stand. I'm just going to have you move back just one step. Good. And now I want you to walk normally. Okay. And you're going to move back to your starting position. And now I want you to walk on your heels only. Excellent. Move back to your starting position. And now on your toes. While you walk, I'm just observing. And your walk or your gait is normal. Now I'm going to ask you to stand with your feet together and close your eyes. Now you're going to hold out your palms in front of you with your palms up. Any dizziness? Nope. And you can put your palms down. I'm going to ask you to stand on one leg. Close your eyes. Any dizziness? Nope. Okay, good. And the other leg? Excellent. All right, so this concludes our focused assessment of the gastrointestinal, musculoskeletal, and neurological systems. Thank you for being in my video. Thank you.